Forum Chair, Jean Butoki. Eric, good morning to you and thanks for your time. You heard part of that interview there. You've been following these developments and commenting on them as well. Let's perhaps start with the human impact of these protest marches and these blockades at various clinics. How are they affecting vulnerable patients, including those needing chronic care and emergency services? What's been the impact?
Yes, good morning and morning to viewers. The impact is very huge and very unfortunate because a big number of patients who were supposed to collect their medication, they are not collecting them pending this, what is happening. And what is much disgusting is the slogan, which is ongoing of undocumented foreigners. Let me make that clear first. There is no people who were undocumented who were chased out of the hospital. They were documented people, and some of them naturalized in South African. And the police which were there, they were also asking people who produce a South African ID that where did you bought them? And those people, they're here in South Africa for 30 years, some of them. So the issue of undocumentation is not true. The majority of the people were chased away from the hospital. They were carrying their South African ID, and the other, they were carrying their refugee status.
When you say a large number of people can't collect their medication, Eric, do you have a number for us?
Yes, we do have a number. More than 50 people from Tuesday to now, more than 50 people were chased away. They were having appointments. And we have videos and a list to produce to you if you need some.
So let's go back to one of the common concerns or criticisms, Eric, or the argument that's put forward by activists leading these marches, whether it's Operation Dudula or whether it's March on March, is that migrants or foreign nationals are basically taking resources away from South Africans in public health care facilities, and that their presence is impacting access to South Africans. How do you respond to this, to this accusation or claim?
I will call that misinformation or ignorance, and maybe not being able to know what is happening. Because if they claim that foreigners or refugees and asylum seekers, they are using resources meant to South Africa by taxpayers, how do they pay tax? I believe in my small knowledge that foreigners as well, they do pay taxes. How do they pay taxes? Because the foreigners who live in this country, they do pay taxes as well. So if it's about paying taxes, we all pay tax. So the issue here is not about taxes, it's political motivations which is behind the whole issue. And that's what we call it administrative xenophobia. It's xenophobia on its own, and mostly Afrophobia.
Yeah.
Because if you call it and you connect the dot of the speeches and the comment made by some senior officials in the government, so this is a result. We cannot call it like we assume it's a coincidence for the March groups and activists to be there. No. If you go and read the speech which was given recently by the KZN premier of the province, he said it clearly that he's going to speak to the HEFMEC to only people carrying a South African ID to be allowed inside the hospital. So what is happening is a result of what was insinuated, I can say, by the ministers and as well as the premier of the province.
You talked, Eric, about misinformation, and this is an opportunity then to counter this information that's in the public domain or that is being framed by these particular groups to bar service and access. What data would you like to share with South Africans on the real usage of public health care services within the foreign community?
I would like to share with South Africans that foreign nationals who are in South Africa, it's not everyone who came here for taking their jobs or to overuse their resources. And refugees, especially refugees and asylum seekers who are here, they are protected by the Geneva Convention of 1951, which is South African is the signatory of same. So for that reason, in one way or the other, they do participate in the growth of the economy and the development of the country as well. just because they are denied those rights to fully be integrated in the community so that they can fully participate in growing the economy together with the other South Africans. But whatever happened, anything wrong, it should not be blamed on the foreign national communities.
So the conversation or these engagements, even these flashpoints we're seeing in different places, Eric, is driven by fear. It's driven by the idea of scarcity. How do we move this conversation forward to bridge the gap between these two disparate communities?
The most important tool which can be used, we have two suggestions there. One is there should be a social cohesion way, which led by the government and maybe by the international community, where South African community should be informed the difference between the types of foreigners who are living in South Africa. Because we have refugees, bona fide refugees, we have asylum seekers, and of course we have migrants. And on the stem of migrants, there's those who are here are the workers who are on the work permit, others they are on student visas. So they need to be told the difference and what is the right of these different groups of foreigners living in South Africa. The other aspects, our perception at the SAROF is the South African is failing. South African government is failing to maintain the issue of the migration and especially refugees and asylum seekers. So they should change the policy of non-encampment. We think it's a time now that refugees and asylum seekers should be kept in the camp, because there we believe in the camp, they will be assisted more than what is happening in the community now. Because we had so many speeches, even at school, children have been denied the right to go to school. But if we're in the camp, I think it will be easy for them to access all those facilities.
Just a very quick close then on that idea. It's quite a radical idea, Eric. What lessons do you take from camps in other countries across the African continent on how well they serve people who are at risk?
Yes, people are at risk in other countries. They are well maintained more than refugees who are urban refugees in South Africa, because these urban refugees is excluding the refugees living in South Africa from all aid and assistance, social assistance. They should benefit like their counterpart refugees in other countries. In South Africa, they are not having any assistance, saying that they have a right to work and study. But this right is being denied, and it's being denied by government officials. So we prefer the camp rather than being arrested on the roads and the streets of South Africa.
Southern Africa Refugee Organizations Forum Chair Eric Butoki, thank you for talking to us this morning.